here in South Louisiana, anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting. So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
I'm back. One more time. All right. Sorry, guys. Technical difficulties. How are y'all? Good day, everyone. I'm Dr. D. If you don't know who I am and somehow you found yourself to Tea with Dr. D, welcome to the show. I'm Dr. Derek Hines. I'm the founder of Acadiana Pain and Performance in Lafayette, Louisiana, and Hero Health, where we integrate the best research, technology, and treatment to give patients better outcomes, elite performance, better health and recovery, and take that as far as we can possibly take it. You know, we always are trying to take patients from healing to health to optimization. So very fun to kind of be on this journey and help y'all kind of get some of the information that is sometimes confusing, misconstrued, different. Today, I wanted to talk to y'all a lot about peptides because we've gotten a bunch of questions. So bring any peptide questions you have, lay them on us. I know that a lot of you had sent in peptide questions or commented on some of the past videos to make sure that we got to them. So we're going to dive in and we're going to talk a lot about peptides and answer a bunch of peptide questions today. If you have any other questions, by all means, let me know and we will answer whatever health question you have if you have joined us. But I know most of the questions that we had pulled are going to center around peptides, and we'll do a deep dive as much as we can. So welcome to the show. Before I dive in, I am drinking a very light pu'er tea. And if you're not familiar with the health benefits of pu'er tea, you should dive in and take a look at it. It's got a very like earthy flavor and it's got a really good health profile. So cheers. It's a good little afternoon tea. Doesn't really keep me up or any of that kind of stuff. It does have a caffeine profile, but it's very light, especially if you do kind of a quick steep. So, all right, let's get into it. Hey, Patricia, we'll make sure that we answer as many of these questions as we can over the next, let's say, half hour or so. But drop any question you have in the comments. Welcome. Thank y'all for joining us. Patricia asks, do I need blood work or other testing before I start peptides? And I know we pulled this from you, Patricia, but I got this question from so many different people. Do y'all do blood work before? Do you want to see blood work before we do peptides? And look, I'm going to preface this with every situation is unique, and this answer could change based on how, what do you have going on and what we're trying to do with peptides. So not everyone needs to do this big lab panel before they start peptides. I think the first thing is, what are we treating? What are we trying to treat? If it's a metabolic issue versus inflammation versus like a tendon or sleep, then each one of those is going to require a different level of like preemptive testing. So like, let's say that we are using peptides to affect metabolism or hormones. like let's say we're considering a GLP-1 peptide, then we care a lot about glucose. We care a lot about A1C. We care a lot about kidney function and liver function, and body composition before we would have the conversation around GLP-1s. So, in that case, we do want some blood testing to tell us where you're at. If we're looking at hormone related peptides that get into like the testosterone pathways, then we do want kind of complete hormone and metabolic pictures before you start to affect any of those things. But if we're like more in the regenerative peptides, then there's less about testing, in terms of blood testing, and a lot more about diagnosis accuracy, and then immune health in general. So there are times in that where we want to know your micronutrient balance. We want to know, do you have all the building blocks of health inside your body before we start to go down that pathway? Because we want efficiency. We don't want you to have to waste time or money. So when it falls into the healing, like I'm working on tendon, I'm working on inflammation, then it's less reliant on blood testing, and much more on diagnosis accuracy. So the testing should match the peptide and the problem, not just check a box. You don't need to just go through a bunch of testing just to say you did it. So each case is individualized. If it's going to affect hormone pathways, if it's going to affect metabolism, if we want to check it for systemic inflammation, let's say you're using a peptide like KPV because someone has a high CRP level, then it is ideal to have a baseline, because you want to know how much progress you're making as you go through time, because we want to know when we can start to pull back and come off of it. That's how we think about it a lot. So I hope that helps. Make sure you get with a practitioner that's looking at the full picture and it's not just checking boxes. And then, kind of go from there, depending on what you're taking peptides for, I think is the real answer. Make sure that, whatever tests match your problem and match the peptide function that you're going to be looking at. Hope that helps. Hey, Mason, how are you, my man? Been a while. Do injectable peptides work better than pills, or can oral peptides still be effective? This is one of the most, I'll say, like, contentious areas. And in fact, in like one of the videos that we were talking about peptides, I got a bunch of like responses, and usually it was not from practitioners. It's from like the lay person, who was like, pills don't work, and you have to inject everything, which is 100% not true. Take a peptide like BPC that gets absorbed in your stomach acid, that can 100% be taken orally and absorbed very, very well. There are a lot of peptides that have been made into a liposomal form that can get absorbed in multiple pathways, whether that's orally. Not every one of them can be absorbed, through an oral or pill form, but a lot of them can. And what we see is that the consistency of injectables is not as high as the consistency as oral. So while I would say if you could do everything, the same doses, the same frequency and everything, would I give a leg up to injectables? In most situations, yes. But what we find is that because people are more consistent and they are able to take the oral more regularly and they don't miss, that it evens out in a lot of situations. So, in general, we don't see a major difference in BPC, oral versus injectable, in TB4, oral versus injectable, in KPV for sure. I have some cases where I actually think the oral delivery of KPV for reducing inflammation seems better than the injectable form. So it's certainly not that injections are always better. For that specific peptide, do we have an oral version that can reach the target that works? I would say injectables are often more predictable, but the oral peptides are more convenient when we can find a really good source that is well absorbed. And that's the big thing, is like you start looking at peptide, the word peptide in the world today, and everyone's trying to sell you something. So finding somebody who makes a really good one is a challenge. So like find a company, find a practitioner who uses a lot of peptides so that they can direct you into really good, well-formed companies. The other thing I'll say, and people are going to hate me for this one, I would stay away from like mom and pop peptides, like these small, like new companies that are coming on saying that, you know, hey, we have our own peptide. That makes me quite nervous. If somebody's like, oh, you know, I met this doctor who makes their own peptide or whatever it is. Maybe you found one that's really good and they're making a great one on their own, certainly in an oral standpoint. But in general, I want somebody who's doing, you know, third-party testing and they're checking it out, and they have a really good track record and it's highly absorbable. So it's not as easy as injections are going to work better than oral for sure. Just make sure that when you're looking at this, the type of peptide that you're using has an oral bioavailability, and how often do you need to use it? So I hope that helps. I get so many questions on that. Ashley, what's the difference between peptides that help with healing and peptides that help with weight loss or metabolism? Good question. I think people think of these things as like very different. So think of peptides as like the signaling molecule. I call peptides like the foreman. They come in and they kind of start barking orders and telling everything what to do. So peptides tend not to do a lot of work themselves, to be completely honest with you. Peptides are the signal to tell the rest of your body what to do. So some of them affect appetite, like your GLP-1s, are insulin signaling. Some of them are meant to encourage growth factors and tissue repair. Some of them tell your body to reduce inflammatory response, or gut healing, or gut support, or tendon and muscle healing. So when you're looking at those, they're all coming like from the peptide being a tiny like miniature protein that carries directions into the body. What are those directions matter? Because like I had this conversation with a patient who was saying, I was like, have you, we're talking about regenerative peptides to heal a tendon. And they're like, yeah, I've taken that. And then we started digging and they were like, I've taken a collagen peptide. That must be doing the same thing. And, because they're signaling molecules, we really do need to work with someone who knows what signal we need in our body and how it's going to affect our health and healing. So, certainly if you're looking at like, a GLP-1 peptide, GLP-1 agonist, those have been studied a ton because they're making a whole lot of money. And so people are willing to pay for the testing of it. And then you have some that are like BPC 157, where, the double blind studies are challenging because there's not like one pharmaceutical company that can lock up a lot of the revenue they can pay to do those studies. So all peptides are signaling molecules is the difference. The signal they tell your body is really where their effects inside our cells change. So hopefully that makes some sense, Ashley. Let me know if you have follow-up questions, if you have some specific ones that you wanted to talk about. We can do a little deep dive. Greg, what's the word? Are peptides safe for long term? Or are they something you cycle for a specific period of time? Really, really good question. And this is one that myself and a lot of our friends in the regenerative world are paying attention to, because we want to know that. Now, a lot of peptides are synthetic versions of things that you already have inside your body. And so, if you look at something like BPC 157, that reduces inflammation and generates some healing in a lot of our tissues, a lot of the soft tissues, tendons, joints, muscles. We have that in our body in quite high abundance from a very young age, and then it starts to drop by the time we're, say, 20. And very safe to have that. And in fact, when you look at BPC 157, there's something called an LD50, a lethal dose, where 50% of the population would die if they took that dose. There's no LD50 as far as I can find for BPC 157. So it's very safe. Now, that doesn't mean we should be taking it long term. We don't have that answer. That's not what that says. It just says that, if you take a bunch of it, you won't die. So when we look at these things, I think we're going to start to find more evidence in the near future. I had a conversation with one of my patients who was saying, like, okay, well, if I feel really good taking BPC 157, all my joints feel better, all my aches and pains seem better. If I come off of that, I'm probably going to replace it with my arthritis medicine again. And in that, it's like, what's the lesser of two evils? With my studies, I honestly trust BPC 157 to create less trauma over time than you staying on our arthritis medicine. That's my thoughts around it. We don't have data to tell us how long you should take which peptide yet. I think every peptide should have a goal, like what we're doing with it. In general, the way I use almost everything in like the peptide world and the medicine world is to kind of cycle them on and off depending on what my goals are at the time. So for our patients, we tend to tell them to cycle peptides. It's the rare case where somebody's like, look, just in general, I have so much trauma across my body that I feel better. I'd rather keep taking like a maintenance dose. And as of right now, we believe that's safe, and the studies seem to show that that's safe. And in those situations, we can do it. But I do prefer people to cycle them on and off throughout the year. I hope that helps. Have a goal with them. If you get to that goal and you feel really good, try coming off of it for a little while. And if some of the symptoms start to come back, especially if it's chronic, then go back on, do another cycle of it. Thanks for the question, Greg. Hey, Danielle, how do I know whether my pain or injury is a good fit for peptides versus needing therapy, an injection, surgery, or another treatment? It's a really good question. In fact, I just had this conversation with one of my patients, and I think if we have a great diagnosis of what's going on. So the conversation I was having earlier was on a tendon tear that we knew had failed multiple rounds of treatment in the past. Now, never a peptide, right? But just treatment in general. And about 50% of the tendon was still attached. In that situation, I really think that a great option is to do kind of a combination of treatments around that and use the peptide as the chemical signaling, as we were talking about earlier, to help the repair in there. I'd say the best candidates when we're looking at regenerative therapy in general is that we have a very clear diagnosis. We know what tissue is damaged and we know what we need to do. We have a good internal environment so that treatment and peptides have the ability to proliferate, and my immune system can actually use the signal that the peptide brings in. If I have a bunch of issues from a health standpoint, then the peptide can bring the best signal in the world, but my immune system is going to have a tough time responding to that signal, and it's not going to be as effective as it should. They're not miracles. They are biology signaling molecules. And so, if we really have a good diagnosis, we have a great environment, we know exactly what we're shooting for, and we know how to get treatment in there, into that area, to signal that your body needs to make a change there, needs to heal that tissue, then I think you are a good candidate for it. If you don't know where your pain's coming from, if you don't know what's going on, if you have a bunch of different seemingly unrelated health issues, I would get more testing and get with more, kind of doctor second opinions before I jump to a peptide. I'm not a big fan of like, I'm just going to try the peptides and see what happens. I don't really know. I just want to see if it helps me feel better. That kind of like, let's throw it at the wall and see what sticks with peptides can waste your time and your money. So have a great diagnosis, have a good plan, know what you're trying to accomplish with it. And if that's the case, then you'll do really well with peptides. One thing I'd add to that is like peptides go in your body and they tell a bunch of cells to do stuff. If you have long-standing pain, like if you have a chronic pain problem, you have to have a signal to tell your body to try and heal that tissue. Otherwise, your body thinks that that's just your new normal. If that shoulder's been hurting for years, when you move it in a certain way, the cartilage might not be healthy, or a tendon or a muscle might not be healthy, but your body's not trying to heal it either. So if you don't have that signal to tell your body, hey, we're sending healing agents to this area, you could take a peptide and it's just going to kind of go to all the receptor sites throughout the body. And it's not going to be super effective at healing where you're feeling it the most. So pair it with treatment, especially in long-standing issues, in like chronic issues. So I've seen that where somebody like took it on their own and they had been having back pain forever. They've been having hip pain forever. And like you just start taking that peptide, but their body's not really trying to heal the tissue in there anyway. So it'll be a lot more effective if you're getting something to turn the healing signal back on in a chronic problem. So just an FYI. All right. Ryan, how are you, my man? Can peptides actually repair tendons, ligaments, nerves, or cartilage? Are they mainly helping inflammation? Good question. I would say I'll answer this in two ways. I'll answer this in the research and I'll answer this in case studies that we see in the office. So there's a lot of promising data, especially in animal models, that we can repair tissue, tendons, nerves, ligaments, using, of course, different peptides. You'll see preclinical studies and animal studies in BPC 157 helping to repair nerves, severed sciatic nerves. You'll see significant changes in tendon fibroblasts, so like the growth factor of a tendon, with BPC and TB4 that do really well. GHK copper is one that we see a lot of collagen formation in studies. And so when you look at those things, we do have good data that it is helping to repair tendons, ligaments, nerves, and can really, with the right treatment and support, reverse major injuries, and get those tissues back to native, like healthy tissue. So I think I'm very excited to see future studies, and we want to put some case studies out where it's like, what other things need to happen to make the peptides really effective at repairing those. So to give you like the clinical data, we have seen under ultrasound tendons repair from about 50 to 60% torn to about 95% regrowth. We've seen that in pec tendons. We've seen that in rotator cuff tendons. We've seen that in patella and Achilles tendons. So like really significant changes in the tendon's ability to regrow. Same thing in muscles. We have seen a number of people improve like memory and brain health and reverse some brain related issues using peptides, and reducing inflammation is one that we've seen quite a few people with confirmed high CRP levels, so inflammation, and using a combination of therapy that included peptides to massively reduce their systemic inflammation. So we see it on a clinical level, and we see it a lot in animal models. There's a bunch of studies right now being done throughout the country to kind of get more human studies on peptides. So I'm excited to see some of those things come out. And we've had a number of people who in the next 6 months are going to be coming on the podcast to actually present published data on some of these peptides. So stay tuned. I'm excited to answer that question with a little more data here very soon. So, but good question. Cool. What else we got? We got a couple minutes. What y'all got? Thank y'all for joining us. Appreciate you jumping on. Let's see what we got. Michelle, what side effects should someone watch for? Really good. To make sure you're getting a quality peptide. So I've seen a couple things. If you are getting, let's say you are doing injections, I've seen a number of people who had research-based peptides get like severe injection site redness, swelling, pain. That is not from the peptide. That is a tainted compound. Something is in there that's not reacting well with your body. In the oral forms, I've had a number of people who got very quick like nausea, and in all honesty, like diarrhea from taking some of the oral peptides that we think were not good peptides. You know, when you look at some of those, that's not something that we see in our office with good quality peptides. So if you're getting any like extreme changes, is certainly in like the GI tract, bad dehydration, like really struggling with nausea and stomach irritation, then I would say the quality of what you're taking is not there, because that's not something that you would typically see. So when you look at that, sometimes it's not just the quality of like the peptide itself, it's how it's prepared and where it's prepared. So again, this is why there's a few people we trust in this space, and we tend to stay very close to those people and those companies. So I'm kind of staying away from some of the research only websites as much as we possibly can, and telling people like find someone who's actually getting this at a compounding pharmacy if you are doing an injectable. And then if you are getting an oral, make sure you're getting it from somebody who's doing third-party testing, and you're not getting it from kind of like, Susie down the street, or, the nutritionist or doctor who's like making it in their own lab. So hopefully that helps. I think if you're getting any weird types of side effects or anything like that, usually that's going to be GI. And usually that's going to mean the type of peptide that you're taking is not ideal. Yeah, that's my warning on that. I told y'all this at some point. I had a patient come in and bring in a peptide that she was asking questions about. And I started looking at it. Something looked off on it. And I was like, where did you get this? It doesn't even look like a peptide. And she got it on TikTok. And so listen, if you're getting something that can bring a signal to change your cells in your body, don't buy it off a TikTok shop, please. I don't think that's where we want to be changing our our health are ordering something that is as important as like a regenerative peptide in there. So yeah, that's maybe that doesn't need to be said, but apparently it does. And this was not a young patient. She was older. So yeah, not a laughing matter. But make sure you're getting peptides from a quality source. So hope y'all got some good stuff out of this. I know there's a lot of confusion around peptides. We're here to answer any questions that we can. We're kind of obsessed with everything in the regenerative world, and peptides certainly fall in that. And so if we can do anything to help you make decisions, reach out to us, reach out to the team. We love talking about this stuff. Y'all can shoot an email, info@acadianapain.com, and they'll get that to one of our doctors, and we can answer that. You can give us a call, and we can kind of do a little chat and work up of what you got going on, and kind of go through a bunch of these same types of questions. What peptides work for certain things? What testing would I need before I started certain things, certain types of peptides? So I hope that helps. I will see y'all for Tea with Dr. D. July 28th is our next one. So shoot your questions in. You can send me a text. 801-691-7582 is where we pull a bunch of questions from. And stay tuned. The podcast is the Pain and Performance Podcast. And we've got some really good guests coming up where we're going to be talking about some research on peptides and healing among a myriad of other health topics. So I hope y'all are doing fantastic. Have a great day, and remember, do one thing to just get a little bit healthier today. Build that momentum to keep getting healthier and just moving in the right direction. So have a good evening, everybody. Thank y'all for joining.